It is the most common reason people see their doctor. Are you suffering from aches and pains? Why you shouldn't ignore it, and what your body may be trying to tell you.
Bryce, I want to talk pain. As a natural health expert, you tell your patients that pain is just a symptom. Don't ignore it.
Absolutely not. You know, picture this. You're in your car and your annoying buzzing light goes off that the engine has got a problem. The last thing you do is you pull over, open the hood, and disengage that warning light. It may be annoying, that's the symptom, but it's actionable. You need to get yourself to the mechanic and fix the engine. So too often, although pain is a symptom, we ignore it. And that underlying inflammation that's causing the pain could be signaling some major disease process on its way.
If you ignore the warning light in your car, it breaks down. Same thing for your body, the pain?
Exactly the same thing for your body. In fact, arthritis or nephritis or hepatitis, anything with the end of itis, that means inflammation. And in fact, this riddles this day and age in our society. We have a lot of inflammation. Frankly, it's the underlying cause of a lot of disease.
Chronic pain. Someone lives with it and they just live with it for years. Can you determine the underlying cause of chronic pain?
You can, and there are many tests that I might employ in a clinical sense. So we look at things like cytokines, and what we're really looking at is whether or not the immune system, or in the case of inflammation, how the immune system is working, is whether or not it's balanced or imbalanced. And cytokines are signalers. They're messengers to tell the body to react at a certain place. So they call out, hey, we've got a problem over here, and these guys go over and deal with that problem, whether it's an infection or it's a physical inflammation, perhaps from a sports injury. But what I love to look at is something called C-reactive protein, and it's a general inflammatory marker, in fact, very correlated with heart disease as well. But if this is too high, it's a warning light. It's that buzzer going off, just like in your car, that there might be something more serious underlying, lurking, about to show its ugly head.
So is it possible there could actually be inflammation but no pain?
Absolutely. In fact, we term this pro-inflammatory state. But you can have subclinical pain or inflammation. Your body's in pain, but you don't actually feel it in your joints.
So inflammation is bad, and the takeaway for people is?
Well, listen, if it's chronic underlying inflammation, and it's a medical buzz term of the day because it plagues North America, and we're riddled with this, poor diets and lack of exercise, that also contributes to inflammation. But this can actually cause, in fact, contribute largely to our major epidemics of today: heart disease, diabetes or metabolic syndrome, and even cancer.
For more information about your optimal health and getting tested, log on to myhealthreport.ca.